Hi, I'm Jonah Essers with the Tummy Handbook. Welcome back to my series of videos on food allergies in infants and toddlers. In our first two videos, we discussed what the terminology and biology is of a food allergy, and we discussed signs and symptoms of a food allergy. In this video, we're going to discuss whether you should get your baby allergy tested. And almost every patient who comes to see me for a tummy problem asks the question of whether their child should be allergy tested. And when you're struggling to uncover what could be wrong with your child, it's a natural inclination to want to consider allergy testing. I mean, it's not like your baby can tell us what's in the breast milk, the formula, or the baby mush that could be making them feel sick. So if there was an easy way to get an answer to that question, would you want that? I know I would. Unfortunately, it's not that easy. You really have to understand what allergy tests are available and what their limitations are. So the first type of allergy test is skin prick testing. And this is where we prick a purified protein underneath the skin of the baby. So for example, peanut protein or cow milk protein. And when there's a red bump that appears under there, that's potentially a sign of an allergy. And the first thing to understand is that skin prick testing really tests for whether there is an IgE type of allergy. And if you're not sure what an IgE allergy is, you can review video number 1, which will discuss what that means. But essentially, an IgE allergy is the classic food allergy that you've either seen or heard about before. Your tongue tingles or your throat swells up. You might get hives. You could go into anaphylaxis or shock. And the skin prick test is relatively accurate at picking up severe IgE-mediated food allergies. There are some false positives, which means you could get a bump that potentially is not a true allergy. So the results really need to be interpreted with caution. I highly recommend you get skin prick testing done by a board-certified allergist. And because there's false positives, I do not recommend that you go to an allergist to cast a wide net. Let's send every skin test possible and see what we drag out of the pond. The likelihood, if you send 50 tests on a baby where you prick them 50 times with different types of foods, is that you're going to get at least one, if not more, false positives, and that's not going to be helpful for you. Skin prick testing is really best if you come with a very specific story, like with 1 or 2 foods that you are actually suspicious have caused a reaction. And lastly with skin prick testing is that if you get a negative test result, it's pretty good at ruling out at least a severe or life-threatening type of IgE-mediated allergy. So moving on from skin prick testing, there are blood tests that specifically look at IgE antibody. So for example, you could send a peanut IgE test. And the test is numerical, which means it goes from 0 up to a very high number. The higher the number, the more likely it is that you have a true allergy to that particular food. The lower the number, the less likely it is that you have a true allergy to that food. The low-level positive results are ones that are very hard to interpret and really often are false positives. It does confuse families a lot, and they often remove foods for no good clinical reason based on a low-level positive. A blood test is really helpful in 2 situations. Number 1 is if there's a medical reason why you can't do a skin prick test. And number 2 would be as if you get a skin prick test that is equivocal or confusing and you want some blood work to kind of back up the results. Blood work is very expensive, much more expensive than doing skin prick testing as well, so that is a drawback. So we've covered skin prick testing and blood tests for IgE. Both of those are testing IgE type allergies. The last category I'd like to discuss are non-IgE type of tests. So if you are not having an IgE mediated reaction, you're not having a life-threatening, really quick onset type of symptom like shock, anaphylaxis, your tongue swelling up, these are typically non-IgE reactions, are typically the GI symptoms that you see in babies, like with a milk protein allergy, with mucus or blood in the stool, maybe some tummy pain, some increased spit-ups, maybe some eczema on the skin. And there's essentially no role for classic allergy testing if you think your baby has a non-IgE type of reaction. There is a patch test, which is an experimental test still, where you put a food onto a piece of tape and you put that onto the skin and you leave it there for a couple days and see if you get a rash. This is potentially helpful in uncovering non-IgE type of allergies, but has thus far been largely felt to be experimental, so the jury is still out. The most helpful type of non-IgE test is actually food elimination. If you suspect that you have a food that is causing a non-IgE type of reaction, the best thing to do is to remove the food and see what happens. And we'll cover how to do this in future videos. And lastly, there is a wide array of blood tests specifically looking at IgG, which is another type of antibody. These tests are widely available, they're very expensive, and they've never been validated as helpful in diagnosing a food allergy. And I strongly caution against using IgG blood tests to discover or diagnose a food allergy. So in summary, for classic IgE type food allergies that are quick onset, there are commercially available testing that may be useful, especially when run by a board-certified allergist. Allergy testing is most helpful if you have a good story to tell for one or a few foods that you would like to explore further. Testing for everything under the sun, you run the risk of false positives, and it likely will confuse you. And lastly, for most tummy-related food allergies that are not quick in onset, the non-IgE food allergies, allergy testing is not recommended. Food elimination is going to be much more effective and accurate, albeit more expensive. Thank you for watching. Please leave me a comment below and let me know what you think about this video, or if you have any questions for me, and you can check out my Instagram account to learn more about me. Thank you so much.